Hi, Mike Rankin Jr. here with Pain Free Life in Clayton, Missouri. I am here again with my dear friend and just most wonderful integrative doctor. He is a family medicine practitioner, integrative doctor, energy medicine surgeon, and integrative holistic medicine as well. Kind of specializes in chronic illness. I know most of the people that come to see you guys have already kind of been through the ringer of doctors, like a lot of our patients have. So today we're talking about cannabis, what you can do with it, and what I mean. It'd really be easier to mention what you couldn't help with it, as opposed to what you could. It'd be a lot faster. But we're going to focus just on a couple things here, at least once or twice a week, on things that you can help, and you can grow your own medicine now, people. Okay, right in your own backyard, or actually, I think you have to grow indoors nowadays. But get yourself some lights, you can get set up and ready to go. We can get you a medical card set up and ready to go in about 10 or 15 minutes. So we're going to talk about pain today. Its lack of side effects when it comes to cannabis use, or any harm it does to the body, as opposed to the serious health impact that opioids and things of that nature have on liver, pancreas, mind, everything in the human body. So, Sergey, if you could please jump on in here and let's talk about pain and cannabis today.
Yes, sir. And good to be here with you, by the way, as always. Mike, you and I both know that pain is one of the main reasons that people come to the emergency room, but that's also the main reason why they come to the office. That's why they came to see you. They come to see you and they come to see us. And chronic pain is 100%, well, I should say maybe 95%, but very closely associated with chronic depression, anxiety, and a lot of other medical conditions.
Inflammation.
That's right. That's right. And when we're talking about chronic pain, we're not talking about an acute pain from an injury, sprained ankle, or anything. Again, that's acute. Let's say motor vehicle accident or so on and so forth. Take a fall, recover shortly. That's not the kind of pain we're talking about. We're talking pain about that has been going on for 6 weeks,
or years,
or longer. And the modern medicine does not have an answer to those questions. Well, they do have an answer, but the answer sucks. Let's put it that way. It's surgery and procedures, which are usually unnecessary. That's number one.
Yeah.
Number two is there's so-called opioid epidemic or opioid crisis. Now, let me go into the history of opioid crisis or opioid epidemic. And again, from my perspective, from our perspective, from what I understand, correct that misconception. It's not an opioid crisis per se, quote unquote. It's the fact that our medical system does not have an effective way to deal with pain.
Yeah.
We just, what do we have? We have medicine, drugs, opioids, which have been used for a long time. And all of a sudden, now there is an opioid epidemic and everybody's being taken off, including abruptly, off their chronic drugs that they've been on, and now they're having withdrawals and all kinds of problems.
Yeah, very dangerous stuff to do there.
Yeah, very unsafe. On the flip side, there is, and I just came from emergency room weekend, there are a lot of overdoses, intentional, unintentional, and for God's sake, there's also all kinds of side effects. The term side effects should be actually renamed as something else. Yeah. A direct damage, I should say, from medication, and very common. You'll have constipation, and that actually goes deeper than just constipation. I can go into this for a whole hour here with you. How important the gut is, and if you don't process things through, it becomes toxic. But there's many other things. It shuts down your mind, your brain, and that's. Well,
liver,
the entire body, really.
Thyroid, your intestinal tract. I mean, there's really nothing that is not negatively impacted by opioids and all these types of drugs that people are giving them. And the simple fact, you touched on something. Sergey said a lot of times things like surgeries and others are just simply not necessary. And real quick, what is it, 6-7 years ago now. For 12 years, I had a pain in my right knee. I was told it was never below a 3. Most days it was sitting around a 5 or 6. Some days it'd be a 10. My knee would give out. I'd be walking up some stairs and boom, I'd fall over. Excruciating pain sometimes. I was told by 2 different doctors, several years apart. They did not know what the other said, that I was going to have surgery. It was just, a ramification of working in the restaurant business 18 years, skiing all my life, and so I just, resiled myself to that. That's what was going to happen. Well, my dad came over to my house one day with some energy patches. There was no drugs. They just redirect energy back into the body and help cellular communication. A set of patches cost me, I think, $4.50. In 30 seconds, I fixed my knee that had been hurting for 12 years. That day was about a 6. Literally in 30 seconds, I was hopping up and down on that one knee, and it has not bothered me since. Not even this much. So there are so many options out there for people. It's almost like, Sergey, and I'm guessing you've come across this too in my research. And my dad is always looking for new modalities. It's one of the things I love about him. He's never settling for, oh yeah, I found this works. This is what I'm going to do. I found this works. Great. We'll keep that in the toolbox. Now we're going to find whatever else works better. Cannabis oil, by the way, is one of the best possible things you can ingest for the human body. You are designed to take it in. Anyway,
exactly. We are everywhere from the brain to the toes, to the organs, to the skin, to the muscles. And you're talking pain, there's several types of pain. There's neuropathic pain from nerves overacting or disorder of nervous system. But there's also visceral pain, and there's all kind of musculoskeletal pain. There are a number.
Energy blocks.
Yes. Ultimately, if you want to get down to it, it's a disorder, disease, the imbalance of the body. And once you correct that imbalance, lots of things that have contributed to it is inflammation, sympathetic overstimulation, in other words, chronic fight or flight, in other words, you're just so tight, and contracted that you can't relax. And that's part of the chronic pain too. Neck, back, that's a very common one, but also musculoskeletal. Why do people not recover well from injuries that should be recoverable? It's one of the reasons is they get into a cycle, or they get into a pattern of where the injury pattern continues to evolve, and even evolves into a secondary aspects of, in other words, compensation, which becomes maladaptive. Anyway, long story short, there is a lot of dysfunction. There's a lot of misconception when it comes to managing pain, and it's one of the main reasons why people seek help. Chronic pain is absolutely, it's debilitating. It's a cause for loss of personal, professional, and otherwise, life experiences, and it hurts society and person and family and just everything in so many ways. So let's talk
real quick. Do you happen to run just a little short on time? I wanted to. How would you say effective is cannabis oil on inflammation?
Highly, absolutely highly, and in the personal practice.
And let's be clear to everyone out there in our social media world and wherever, inflammation is basically the root of all disease. Cuts off energy flow, oxygen flow, water, everything you need to have a healthy body is coming. The blockages of those are coming from inflammation.
Yep.
Right.
Well, there are several factors. Of course, mind and emotional and spiritual, it all comes back into picture. But if you want to talk about the physical aspects, absolutely. Inflammation, and of course, hormonal and otherwise imbalances. And the endocannabinoid system is right smack in the middle of the whole thing. And it works extremely well. Some people do very well with just CBD. Some people do very well with THC, and of course, there's various combinations. Now, there's not a single individual that's the same as any other individual, so you have to actually see what works for you specifically.
Well, the good news
good option.
Good news is, unlike pharmaceuticals, while you're trying to find the right strain and right dosage of cannabis that works for you, you don't risk the death or maiming of your liver or kidneys or brain. There's zero chance of that. So I think that's worth mentioning, right?
Number one rule, and I remember this when I was going through medical school, the ceremonies and everything else. Hippocratic oath, the beginning, the foundation of it all.
Yeah.
Do no harm,
Right.
first and foremost.
Right.
And then we come out of medical school and we start practicing, and guess what we do? We start doing harm.
With the things they taught you.
With the things they teach us. Now here, let me just debunk a little bit. It's not. I want to be very clear. I'm not against medicine. I am a doctor. I still work in the emergency room, and I still use drugs as necessary. But in a certain setting, like, for example, the office setting, we have the choice and the option of exploring options, things that work better, safer. And to me, it's a no-brainer. Until the state and the hospitals recognize the importance and the benefit and the use of the endocannabinoid system, THC, CBD, there's a number of other compounds and derivatives that are actually very significantly functioning in the body for chronic pain, for inflammation. And that also talks about the opioid epidemic. How do you get through the opioid epidemic? Now, there's more than one way, obviously, but one of the things you can do is to decrease the dependence or the need for the opioids and get the pain and inflammation under control.
Right.
And that's one of those very solid ways to do it.
And then, hey, real quick, I just want to mention to people, and we're just about out of time, Sergey. So if anyone does know anybody struggling with an opioid addiction, Dr. Sheely, your mentor and business partner, has developed something called a chakra sweep, and has found it to negate like 99.9% of the people's withdrawal symptoms. Cravings, the night sweats, the anxiety, the depression, the agony, pain that'll even come along with it, right? So that is something, we've been talking about and working with for some time.
Exactly.
It's truly a remarkable, amazing miracle device. Hey, real quick, can you give them your email and a phone number for your office in Springfield? But again, people, you do not need to be in Springfield, Illinois. Missouri. You do not need to be in Clayton or anywhere, and even in the surrounding area. You can be out in the sticks. We can hook you up with some email paperwork and a Skype appointment. Sergey, if you can go ahead and deliver your phone number and email, please.
Yep. Let me start with a clinic number. It's 417-351-5221. And when you call, ask for an appointment for the cannabis card. Now, if you qualify, we'll get you taken care of. And if you don't qualify, then we'll try to tell you up front. But
have you had anybody turn down yet, Sergey?
What's that?
Have you had anybody turn down yet for a card?
No, people have been pretty much, I'll tell you, common sense is the least common commodity. But when you apply, when you apply common sense to life in general, that works. And that's what I see with my clients. Most people who have come in, they have a legitimate need to be seen and to benefit from the cannabis plant.
Yeah, everybody can. Everybody can. My number here in Clayton is 314-899-9535, 314-899-9535. You can give me a call whenever you want. painfreelifestl@gmail too. If you want to send me a private email, I'm more than welcome to do that too.
And also, I'll share my email as well. It's just like my name, SergeySorin, Sergey Sorin 74@gmail.com.
Great. Great talking to you as always, my friend, and we'll talk to you again real soon. Have a great day. Bye-bye.